My name is Karina Perez, and I am a student in the Public Policy and Administration program. And we will now have my project partner, Kevin, start us off.
My name is Kevin Seacrest. I'm a senior at St. Petersburg College in the Paralegal Studies Baccalaureate program. Case Study 7 asked us to look at public health versus the rights of individuals in regards to HIV testing and AIDS intervention. The issue presented is how to balance the privacy rights of HIV patients and protect the public health. In Michigan State Police v. Sitz, the U.S. Supreme Court created a three-pronged legal test to weigh a policy to determine if public welfare had more weight than the individual right to privacy. In our case, for individual privacy rights to be violated, the following three questions must be asked. 1. What is the state's interest in preventing transmission of HIV? 2. What is the effectiveness of HIV testing in achieving that goal? And 3. What is the level of intrusion on an individual's privacy caused by HIV testing? Any policy decision in regards to testing must take these three questions into consideration first.
Hello, it's Karina again, and I'll be talking about stakeholders and their perspectives for this case. So I'll start going over at-risk individuals and go more in depth about that and break that down, and then we'll get more into the other characters that were presented in the story. So we'll start off with members of the LGBTQ community, and we know that individuals do respond well to HIV education and are practicing what is taught, and there are some cases where an individual may test positive for HIV and they can take that news really bad. They take it as a death sentence because they perceive it as still a negative stigma attached to being HIV positive. And if we're able to provide counseling to where we can help their mentality become better so they're not as depressed, anxious, or stressed, and we're able to help provide medical help, and we're able to make sure they're taking all the medications that are needed so they can live a somewhat normal life again, that would be helpful for them. And the next group we're going to talk about is prostitutes and sex workers. So we do know that having easy access to condoms and other protections are helpful, so through distribution programs, because it helps the infection rates from growing in a community, because either they may not have the proper sex education to where to protect themselves, or they're not getting tested regularly. And so if there's a program that we can allow quick and easy access to a test for HIV and other sexually transmitted diseases, it would allow prostitutes and other sex workers to get the results and hopefully change their behavior and get the help that they need. Because if we're not able to change the behavior or their mentality about the whole issue, then it's just going to be counterproductive to what we're doing. Because if they don't want to change, then their program's not going to help them at all, which is something we don't want. We want to be able to help them as best we can with all the resources that we have. So the next group that we're going to talk about is drug users. Share needles or use dirty needles that they find off the ground that may have already been used before by several other people. And we do have needle exchange programs that are helping somewhat. So it helps get the dirty needles off the streets, and in exchange you get a clean needle. But with this, it's also kind of bad because while they are getting a clean needle, it doesn't stop them from using drugs. So if we're able to provide drug abuse counseling to those individuals and maybe even send them to drug rehabilitation. That way they're able to get back on track and live normally, and that way we are able to help the fight of slowing the spread of infection in a community that way. And the last group we'll talk about is the homeless and low-income individuals. And usually these people are targeted a lot already with shelters, like shelters and clinics and HIV clinics that are already set up. And so these individuals usually don't have a good sex education or haven't gotten it, and usually are also drug abusers as well. So there can be multiple reasons why they're not taking into account of being safe, and their life choices, and there may also be a lack of access to health education and health resources that they can go to. So if we're able to provide the counseling, the rehabilitation, shelters, medication that they need, it will be really helpful for them in the long run, because we're able to change that behavior from the get-go with intensive therapy. That way they're able to be to become a productive member of society without harming others in spreading without spreading HIV in the community. And they can help inform others and help tell their stories as well, as a way of inspiration for others to hopefully get them tested and see if they are positive or not. That way they're able to get help also. That could be a good thing too. So the first character that pops up is Jean Pizze. And Jean Pizze is a policy planner for the local health department in the major city within the story. And he wants to find the best way to deal with the transmission of HIV in the community through testing and healthcare aid. And he does that by getting research from outside sources. So he knows that, or he learns that having a intensive, big program would really help, because if you only have like a small program, he learns that it's gonna be counterproductive to those individuals in the at-risk communities. So he would be in favor of using those programs. And then we have Dr. Nora Smith, and she's the head physician of the health department and Jean's boss. And Dr. Smith is responsible for treating individuals in the community from all walks of life, especially those that are in low-income areas. And she has hired a team of policy advisors to look after ways her health department can best combat the disease and prevent further spread of HIV in the community. And her opinion on this is she would have preferred a strategy that was less reliant on social action, as she's not too sure about the effectiveness of public service announcements, counseling, and outreach efforts. So she favors tactics that are more directly tied to like medical advancements within the HIV field, like blood screenings and contact tracing and more direct condom distribution. And lastly, we have Carlos Hirsch, and being affected as a death sentence, as I said earlier. And he even said in the book that he started like a shelter program, but because it wasn't like fully staffed or had all the people it needed, it didn't last very long, even though they had the money for it. So he tells Gene that, and that helps Gene to form his own opinion on the matter. Alright, so we will now start off by talking about the members of our community that are affected by our case. So we'll start off with law enforcement, and we learned through our expert interview about this one, because you would think that law enforcement would see all these outreach programs as good, but there is one that they do not like, and that would be needle exchange programs, because while it does help communities fight with growing infection rates, it does grow drug usage rates in an area, even though they are given clean needles in exchange for dirty ones. So if we are able to do that, but also get those people into drug rehabilitation centers and drug counseling, and then sex and HIV counseling, and provide sex education, that way they can help change their behavior. Because if you're not able to change their behavior, and all the stuff that we would be providing would just be counterproductive for those individuals. So if we're able to target those individuals at a faster rate through these programs, help stop the spread of HIV in a community. Alright, so now we'll talk about taxpayers, and taxpayers are the ones who fund grants that are giving out to these programs, because most of these programs can be state run, but there are some that are public, that are privately funded through donations. And so if we can find a way for taxpayers to see that their money is being put to good use, and they're able to see rates decline in their community, they would be more inclined to help volunteer at these shelters or donate items that these shelters may need, whether that's like home supplies or cleaning supplies or food or clothes or basic necessities. Then it would really help the community grow awareness to the issues that are happening in their community, and be more inclined to help, because they know that their tax money is being put to good use through these shelters.
Joy Winheim is the Executive Director of Empath Partners in Care, EPIC, a member of Empath Health, a nonprofit integrated network of care supporting those challenged by chronic and advanced illness in the Tampa Bay region. They offer a wide variety of medical care, counseling, support, and prevention services at their multiple locations around the Tampa Bay area. They provide seamless care and support that helps their clients maintain healthy and self-sufficient lives, assistance to families, and HIV testing and education in the community. Ms. Winheim has over 22 years of experience working in addiction recovery, as well as HIV services. She started her career as a substance abuse counselor and found that many of her patients were also HIV positive. This led her to her work with Francis House that would later become EPIC. As a director of EPIC, Ms. Winheim is responsible for making sure that the local community is served through medical case management, housing assistance, support groups, mental health counseling, psychiatric medication management, pharmacy access, meal assistance, prevention services such as sex education outreach, HIV testing, as well as access to prophylactics and a needle exchange service, and many other support services. EPIC also has a mobile testing unit that goes to different places across the Bay Area and delivers no-cost rapid HIV testing. The mobile service is a big part of their prevention program. Here, individuals are given learning materials and access to help. Throughout our interview, Ms. Wenheim stressed the importance of disease prevention. The approach EPIC has taken to combat HIV is through service to those at the highest risk of contracting the disease. By building relationships and trust with at-risk communities, EPIC is able to implement a testing program that retains participants after an HIV diagnosis. Another approach taken by EPIC to serve the at-risk community is through disease prevention. EPIC is building relationships with these individuals by addressing the factors and behaviors that contribute to higher chances of infection. To address these issues, they provide safe sex education, access to condoms, addiction recovery services, along with other social aid initiatives. By alleviating factors that lead individuals to participate in high-risk behaviors, EPIC has opened the door, allowing people to make safer choices. When people make safer choices, the risk of infection can be dramatically reduced. These services are all made possible because of access to pass-through grant funding from their multiple partnerships across the Tampa Bay area. They also receive a smaller portion of their funding through charitable donations from the local community. HIV has a disease vector dependent on human behavior. Unfortunately, although there have been many advances in HIV treatment, there is still not a cure. The only proven and tangible way to slow infection rate is through behavior changes in individuals. By providing intensive, targeted counseling programs and other social services to at-risk individuals, we can improve quality of life and infection rates in relation to HIV. These types of interventions do not diminish the protections of individual privacy rights and assist public health concerns by mitigating the risks associated with HIV transmission. It is our opinion that federal and local grant funding continue as it has to allow pass-through funding for private, non-for-profit organizations like EPIC. Until there is a cure, focus on behavior modification through outreach is our recommendation.